Suicide is the second leading cause of death among college students. That's according to the American College Health Association. As we near the end of Suicide Prevention Week, Newsday Now's Dua Israr spoke to mental health experts on how students can ask for help even in an unfamiliar place. Good evening, Dua.
Ken, for people struggling with mental health, it isn't always easy reaching out. Mental health experts say it's up to friends, families, and educators to notice the warning signs and just take a few minutes to talk to someone about how they're doing. For some people, college is where they find their identity.
It's this opportunity to explore your own values and who you are.
For others, it may be a stressful and isolating experience.
Kind of a fish out of water.
Mayo Clinic Health System social worker Reese Struckenmiller says the W curve was created in the 60s to explain how people adjust to new environments.
We know that when people are going into a new culture, there's this predictable pattern of how they will likely behave.
The letter W represents the mental highs and lows in a new place.
People more freely say out loud, I'm struggling with anxiety and depression, just in common conversation. I was a college student in the 90s. We didn't talk like that.
Brent Brigson has been a mental health counselor for over 20 years. He's seen both the highs.
I love working in a college setting because it's a hopeful place.
And the lows.
People think about suicide.
At both Western Technical College and University of Wisconsin-La Crosse, over 1,000 students seek mental health resources.
The generation that might be starting college now may be somewhat more open to seeking help.
At Western Technical College, staff use a method called early alert. If a staff member notices a student they believe is struggling with mental health, the staff member will refer them to a counselor.
They're trained to ask, do you have somebody to talk to? And if they don't, they literally walk into my office.
Brigson says everyone should take part in an early alert method.
As a society, we need to pay attention to people in our lives. We need to pay attention to those things.
So that a support system is available for everyone. Signs of anxiety and depression can include a change in eating and sleeping habits, frequent moments of anger and frustration, as well as isolation. Brigson says the first step to moving forward is realizing those changes in behavior.
All right, thanks a lot, Dua. If you or a loved one is showing those signs or just need someone to talk to, you can call the National Information and Crisis Line at 988. For the Wisconsin line, you can dial 211.